Our first speaker will be Dr. Louis Reynolds. Now, Dr. Louis Reynolds is a retired pediatric ICU and lung specialist. He's a member of the People's Health Movement South Africa Steering Committee and the Advocacy Committee of the Department of Pediatrics and Child Health at the University of Cape Town. And he's also a not yet retired health and human rights activist. Louis will be talking about the relationship between climate change and health systems. Over to you, Louis.
Okay. So I'm going to speak about health systems and the global ecological crisis. I think everyone in this webinar should know that South Africa's health is really in a crisis. And it's not only the health of individual people, but the health of the nation. And it affects also our health systems, both the public and the private health systems. In 1912, there was an early warning from a newspaper in New Zealand called the Rodney and Otamatia Times on the 14th of August. So it's not as if we weren't warned. This article appeared 100 years ago in a small New Zealand newspaper called the Rodney and Otamatia Times in their science notes and news. And the article talks about coal consumption affecting climate. The furnaces of the world are now burning about 2 billion tons of coal a year. When this is burnt, uniting with oxygen, it adds about 7 billion tons of carbon dioxide to the atmosphere yearly. This tends to make the air a more efficient blanket for the Earth and to raise its temperature. The effect may be considerable in a few centuries. And sure enough, a century later, the editor of the British Medical Journal in the editorial wrote that the greatest threat to human health is neither communicable nor non-communicable disease. It is climate change. This is Fiona Godley, the editor. She said that when she wrote this, she felt it took a certain amount of courage from her, because to put climate change on the agenda of busy doctors seemed a bit difficult for her. She was a bit almost embarrassed about it. So how does climate change harm our health? It harms our health through direct and indirect pathways. And it affects particularly people who are vulnerable because of biological, social, economic, or political influences. So climate change causes rising temperatures, more extreme weather, rising sea levels, increased CO2 levels in the atmosphere. And this affects not only the temperature, but it affects the weather, air pollution, changes in vectors. Vectors are insects and so on that carry disease around. They move to different places. It increases the amount of allergens in the air, decreases water quality, and so on. And this leads to a whole lot of other effects. So these are all the mental impacts, injuries, accidents, interpersonal violence, mental health, heat-related illness and death, forced migrations, civil conflicts, and malnutrition and diarrhea. And these diseases here in the bottom right-hand corner from bad water, etc. So the impacts on health are severe. And not only where we live, but impacts in other places cause people to move and find better places. Some places are becoming uninhabitable. For example, in 2003, there was a heat wave in Europe, not quite as severe as the heat wave they're having now. But in France, in August of that year, 65% of the people who died in France were excess deaths, and they were deaths from heat, mainly old people and small babies. And these are excess deaths in other countries, in the red over here in Europe. But France was the most impacted. Here at home, in KZN, a few months ago, we saw the floods that killed more than 400 people, made thousands homeless, robbed people of food and drinking water, making more people at risk of disease. People lost their medications because they couldn't get access to their health facility. Personal insecurity plus loss of work. Today in Somalia, there's an enormous tragedy unfolding as we speak, with 7.1 million people facing acute food insecurity and catastrophic hunger looming, and many, many people having to leave and migrate to find better places to live. So these are the impacts of climate change on health. So there's no doubt about that. But about 50 years ago, Ivan Illich, who is a bit of a radical kind of thinker, wrote a book called Medical Nemesis, in which he said that the medical establishment has become a major threat to health. And this is really the elephant in the room when we're thinking about climate change today, when you're talking about health and climate change. Ivan Illich was worried at that time because he felt that the medical establishment, the thing we call today the healthcare industry, had become a major threat to health because it was depersonalizing and kind of turning health into a technical, marketable issue. That there was robbing people of their ability to look after themselves. And this was in the interest of power and money. And that we were becoming, instead of people, we were becoming consumers or clients of healthcare. He was worried about that the medical establishment was losing its caring ethos. But today his prediction has come right in a different way, and that is that our health systems are aggravating climate change, a thing that the editor of the BMJ called the biggest threat to health in history. And this is totally absurd, as the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says. Health facilities are the operational heart of service delivery. They should be protecting our health. But they churn out CO2 through their use of energy and energy-hungry equipment. So instead of being caring and not doing harm, we are becoming, with our health systems, harmful to our own health. And this is a completely absurd situation. So how does this work? Well, healthcare produces greenhouse gases and a whole lot of other pollutants. 4.5% roughly of global greenhouse gas emissions of carbon dioxide comes from our modern healthcare systems. This is equivalent to more than 500 coal-fired power plants, big ones. And to me, this is a striking thing, that if the health sector were a country, it would be the 5th biggest greenhouse gas emission emitter on the planet. Where do these emissions come from? Well, most of them come from fossil fuels. And a lot of them, as Aziza said earlier, comes from the production, the transport, purchasing, and disposal of goods and services. There are also direct emissions from healthcare facilities and the vehicles that the health system uses to get around, including vehicles used by patients, visitors, staff, transporting of equipment, and so on. And then there are other indirect emissions from buying electricity and so on. So these are the main sources of the cell system's greenhouse gas emissions. A few years ago, when I used to teach health and climate change. I used to give a lecture. I went to Ecological Hospital to see what their emissions were. And Ecological Hospital at that time was burning 34,000 tons of coal a year. That's more than 9 tons every day in these massive furnaces that you see here. And that's one hospital in one little country, in one little city. So what's to be done? Well, we have to move good healthcare out of the hospital and into the community to make it more accessible, so people don't have to travel far to the health department to get healthcare. And people can understand their healthcare and how the health system works. We have to deliver healthcare through more multidisciplinary and less hierarchical team-based approaches. We have to all this thing of moving healthcare out of hospitals and into the community means respect and support for community health workers. I know there's several in the audience today with good working conditions and remuneration. Then from there, you need seamless referral to the more central hospitals, the secondary and tertiary levels of care. The health systems have to prepare for new pandemics. The next one is looming already with, monkeypox and new patterns of disease. And health science faculties need to think about who they're teaching, who they recruit. And we have to have more generalists rather than more specialists who can think critically and who want to and can work in community-based settings. We also need to do as much as possible locally at community level, which is another reason for community-based primary care services. For example, common and routine lab tests, if you're doing in the facilities instead of sending them to big central laboratories. A Swiss study recently found that if you increase distance to the health facility from 5.5 to 15 kilometers, the footprint of an average consultation goes up by 56%. Mobile patients and staff and visitors can travel on foot or by bicycle as much as possible where it is safe. And this is key to primary healthcare. If it isn't safe, get the community to do something about that. So there are many things that can be done. And having local health facilities at work are very important. Then, to reduce the burden of disease and the burden on the health system, it's essential to get state sectors to work together, to break out of their silos and work collaboratively to address the social determinants of health. And these are listed here in this diagram. And you can see that these cut across state sectors. And because all these things come together locally at community level, full community participation, excuse me, is fundamental to getting these systems to work to address the determinants of health. And this is what brings me to primary healthcare, because primary healthcare is health by the people. It means that people are empowered and become agents to find and do something about the causes and the causes of the causes and the causes of the causes of the causes of ill health in their community. This is not a new idea. This is a pretty old idea, but we never seem to get there. So as an example, I want to tell the story of 4 children who died in 2011 near a place called Verdwaal, which is in the Northwest province. Verdwaal means lost. One hot morning, these 4 children, Sebengu, Mapule, Olebogang, Wara Betswe left home. It was a hot day. Sorry. The temperature that day went up to 32 degrees. They left home in this village to look for their mother. And the mother of these two younger children and the sister of the two older children, because she'd gone to find food for them. They followed her, but they never got back. When she got home later, they were missing. Their bodies were found later in a field. They were found in two, they died separately. They died of hunger and dehydration. They, post-mortem showed that they had not eaten properly for weeks. Question is, why did they die? So why did they die? They died of hunger and thirst. But that was only the immediate thing, the immediate cause. Why were they hungry and thirsty? They were hungry and thirsty because there was no household food security. There was inadequate care. There was an unhealthy household environment, maybe a lack of services. So these are the immediate causes of maternal and child undernutrition. This is UNICEF's conceptual framework for malnutrition. And below this, you have income poverty, unemployment, just poverty. And if you go lower and lower, you find the basic causes, which end up being social, economic, and political. This is why we teach in our South African People's Health University this exercise called the but why exercise. If there's a problem, you have to dig below it and find out what the underlying causes are. And the underlying cause, a major underlying cause, is climate change. So primary health care is not about clinics or about hospitals or about, well, it is about those, but that's only a small part of it. Primary health care means that the whole health system, from the community, from the household, is in continuity. And that is built on a foundation of community mobilization around health and intersectoral action on the various social determinants of health. But the Alma Ata Declaration, where primary healthcare was kind of formalized, went beyond this and also called for a fair new international economic order. From this call came mainly from the non-aligned movement to promote social and economic justice in the wake of the wave of decolonization that at that time was moving through the third world. So these are the things we need to do to tackle climate change and health. The question we want to look at briefly is, does the NHI provide an opportunity to do this? Well, the NHI can make a start. It's, given our health crisis, it's absolutely imperative to change the way we as a nation deal with health and disease. And if we want to, we have to change our health system, but we have to change much more than the health system itself. But looking at the NHI can really only go as far as the health system, but it's a start. And to get the NHI to do this, it has to prevent corporate vested interests from capturing the NHI fund. It has to get the two, these are corporate interests in the corporate profit-making private health system. I'm not talking here about private doctors working and rendering a good service for reasonable income. I'm talking about the big corporations that make huge profits out of people's illness. So we should rather we should try and get these two sectors to recognize that the country needs all our healthcare resources working together as a single service for everyone, delivering care according to need rather than means. We need openness, transparency, and accountability to fight the corruption that's happening at all the levels of the health system. We must understand universal health care or universal health coverage as care delivered according to need, rather than as an insurance system delivering care to members at different levels of risk and different types of services. And we must also heal the nation. The South African, we need as a nation healing by building social solidarity. And then we must ensure that the health system that we develop out of the NHI is sustainable and green. And that's where I'm ending. Thank you very much.